When the Axis armies in Tunisia gave up in May 1943, around 275,000 German and Italian fighters became captives of the Allied forces. Among this group were German medical workers who would find something never known before in the time of war. They were seen as professional friends, not just people who were caught. This is their real story, pulled from old papers and official reports. Before we continue, show your support by subscribing and letting me know where you're watching from. The 1929 Geneva Rules set up specific guidelines for medical staff captured in wartime. These rules explained what would happen to the German medical officers the Americans held. The treaty's demand for proper treatment of captives meant they got paid by the American Army, and officers didn't have to be made to work. Medical staff, especially, couldn't be forced to do non-medical tasks and kept a few of their professional privileges. The United States, since it had agreed to the Geneva Rules, followed them fully. German medical workers learned that America's promise to global laws was stronger than what they had experienced in their own. Military German prisoners of war were usually put on big cargo ships that were sailing back home and had no cargo. As many as 30,000 arrived monthly at ports in New York or Virginia, where they were sorted out and sent to various camps. The nice attention began with the big meals they got on the ship ride. The trip itself showed the first hint about America's wealth and how they managed prisoners. Instead of the freight cars used for moving prisoners in Europe, German medical staff traveled in regular passenger cars with regular meals. This was a smart choice, but it had a strong feeling of kindness. By the end of 1943, German prisoners were placed across many camps all over the United States. Texas, with its climate thought to be like North Africa's, just like the Geneva Convention asked, had a very high total of these camps. 3 more camps were approved in 1943. These included Fort Sam Houston in San Antonio, which was mostly a tent city with big tents for both the prisoners and their American guards, as well as Camp House in Gainesville and Camp Hood in North Colleen. The medical buildings at these camps were varied, but usually nicer than what the German medical officers expected. The camps had small treatment centers and in some places big hospitals where German medical staff were allowed to work. The biggest takeaway from the German medical officers' time was the professional regard they received from American medical leaders. There were several cases of German doctors who were captives helping Americans, and American doctors who were caught were assigned German wounded to care for. In most cases, captured doctors were treated as respected co-workers by their peers. One American doctor shared that he and German doctors openly shared skills and learned different medical ways from each other. The American medical team generally provided the same level of care to hurt German prisoners as it did to American soldiers. This professional respect wasn't merely pretend. German doctors were addressed by their medical titles, asked what they thought about medical cases, and included in medical discussions. This kindness was a huge shift from what they'd been told by Nazi false stories about American life. The medical centers and American prisoner of war camps showed a strong promise to the health and comfort of the prisoners. The hospital at Camp Butner looked after almost 14,000 patients. Beyond healing them, they offered help returning to society, technical and work-related learning, career guidance, and basic education. The staff totaled 2,200 by late November 1945, with support from 414 German prisoners of war. Patients recovering got attention all day and night. These centers helped both American soldiers and prisoners of war, creating a shared medical space where German medical teams labored alongside their American co-workers. The equipment and supplies in these centers were often superior to what German army hospitals had. Even before the war ruined Germany's medical system, German prisoners of war, including medical staff, were offered chances to study that would have been incredible, even for those who weren't captured. Almost every camp had a room full of books with donated books and magazines, some as large as an average high school. Camp Fannin, for example, had a fully stocked library with over 2,500 books and a high rate of borrowing. For medical workers, this meant they could read the newest medical books and journals, written works that had been hard or impossible to get in Germany. Because of the war and the Nazi refusal of non-German medical studies, some camps created amazing ties with American universities. A report on Camp Butner from April 1945 showed 110 prisoners working as dining hall helpers at Duke University and UNC. Although these prisoners were working in non-health-related jobs, the university connection offered German medical staff in the camp a special opportunity to observe American academic medicine firsthand. These university relationships, though not everywhere, proved a level of connection between enemy prisoners and American schools that couldn't have been dreamed of in Nazi Germany. As the United States sent many soldiers abroad, the lack of workers that followed meant that German prisoners of war aided the Allied war effort by working in food processing plants, factories, farms, and other places judged as safe. For medical workers, this often meant working in health facilities and medical centers where their professional talents could be put to use. German medical officers who chose to do medical work got paid according to their rank and job, just as the Geneva Convention required. This money, while not much, was a mark of respect for their professional status, which greatly touched men who believed they would be treated as beaten enemies. The increasing number of German prisoners of war brought up another problem. At first, some nurses weren't sure if they could push away their feelings and give these patients the highest level of care needed. Also, written military hospital rules said that Allied soldiers' care must be prioritized over the care given to enemy prisoners. But most nurses soon understood they could see these men just as patients who needed help, and looked after the Germans the same as American soldiers. This professional mix happened even with initial worries and official rules that put Allied soldiers first. The way American medical staff could keep their professional work separate from national hatred taught German medical officers a lesson in medical principles that went further than political beliefs. German medical staff in American camps saw a huge amount of medical supplies. This was the reverse of what they knew from running out of things during the war. Basic medical items, bandages, medicines, surgical tools were available in quantities that German military medicine hadn't had since before the war started. The fact that medications were so easy to get greatly surprised the German medical workers. Antibiotics like sulfa drugs, which were very restricted in the German army, were used without limits here. The arrival of penicillin in some centers by 1944 showed a cure that German medicine had completely missed. The medical care provided to German prisoners of war was equal to, or even higher than the standards for American soldiers. Wounded Germans got the same surgeries, medicines, and physical healing services as American soldiers. This equal care was required by the Geneva Convention, but was often ignored by fighting countries. However, it was always respected in American facilities. German medical officers saw and were involved in this standard of equal care, learning about American medical ways and moral standards that would influence their medical work after the war. Texas held a lot of prisoner of war camps, which meant there was a large amount of German prisoners, including medical staff. Camp Butner, which covered around 40,000 acres in Granville, Person, and Durham counties, was a combat training base for around 30,000 soldiers. German and Italian prisoners of war were brought to Camp Butner, where they worked as cooks and did other jobs. The size of these places and their medical sections offered German medical officers a look at American military medicine at its most modern level. The contrast from the more and more terrible circumstances in Germany grew clearer as the war went on. The professional connections that formed between American and German medical staff, while held back by the prisoner versus jailer situation, still included genuine professional sharing. American doctors learned better ways for treating injuries from German co-workers, who had a lot of war zone experience. German doctors learned about American advances in antibiotics, pain management, and surgery methods. These meetings, recorded in post-war papers and military files, proved a level of professional teamwork between enemies that was surprising in modern war. The role of nurses in American military medicine gave German medical staff a look into new ways of providing medical care. American nurses had more authority and independence than German nurses, being involved in medical choices and doing tasks that in Germany only doctors were allowed to do. German medical officers working with American nurses had to adjust to this new professional arrangement, a change that made them think about their own ideas about how medical work should be set up. During World War II, space at the fort was made ready for up to 1,000 German prisoners of war. This happened on September 15, 1942, while prisoner of war camps were being built. Fort Sam Houston is well known as the center of Army medicine and the home of the combat medic. Fort Sam Houston's place as a big medical learning center meant that German medical staff there saw American military medical instruction and training styles. While they couldn't fully take part, observing American medical training gave them ideas about other ways to teach medicine. Dental care in the camps, which is often forgotten in history books, was another chance for professional connection. German dentists among the prisoners of war worked in camp dental offices caring for the mouths of thousands of prisoners. These dental officers got the same professional regard as their medical co-workers. America's concern for prisoner dental health, giving regular care instead of just emergency tooth removal, showed a commitment to the total health of prisoners that went farther than what the Geneva Convention required. German medical officers helped with public health work inside the camps, like stopping disease, checking on cleanliness, and teaching about health. This work showed them American public health methods that cared about keeping people well instead of just healing sickness, an idea that was different from German military medicine's focus on battlefield injuries. The good results of this public health work in maintaining the camp's health, even though they were full of people, was a true example of how effective American preventive medicine turned out to be. The American way of dealing with mental health care especially affected the German medical staff. War-related stress, which would later be called PTSD, was seen and treated as a true medical issue, not as being scared or a weakness. This was the usual belief in the German army. German psychiatrists and psychologists among the prisoners saw treatment methods that included talk therapy, work-based therapy, and medicine. This full approach to handling mental health was very different from the German military's harsh way of dealing with mind-related injuries. As the war came to an end, German medical staff had to go back to a ruined country. Many had been in American hands for 2 years or more, and during that time, they had worked as doctors in conditions that were often superior to what they had known as non-captive doctors in Germany. The return process included medical checkups and health approvals, done together by American and German medical teams. This last professional teamwork made stronger the friendly bonds that had formed during their time as prisoners. After returning home, about 5,000 Germans settled in the United States, and thousands more came back later to visit. Many farmers remembered their prisoner workers with respect and even good feelings. In fact, many farmers kept close ties with them. Among these lasting connections were professional ties between medical workers. German medical officers who returned to Germany carried with them an understanding of American medical ways, how things were set up, and ethical rules. While it's hard to know exactly, their influence on post-war German medicine was important, especially in areas like medical morals, what patients are allowed, and professional quality. The German medical staff's first look at American medical teaching techniques also affected post-war German medical schools. The emphasis on hands-on hospital work, the combination of basic science with real practice, and the structured method of training new doctors were ideas that returning German medical officers supported in the rebuilding of German medical schools. Several German medical officers who were prisoners in America became top medical teachers in post-war Germany. Though it's hard to connect their teaching styles straight to their prisoner experience without looking at personal papers and school records, the story of German medical staff in America is written down in many places. These places include official military files in the National Archives, International Red Cross inspection reports, post-war books and personal stories, news articles from the time, and camp newspapers made by the prisoners themselves. These records, while offering helpful facts, still leave many questions about the true extent of professional relationships and knowledge sharing that took place. German pharmacists and drug experts among the prisoners were able to observe American pharmacy practices, including large-scale manufacturing, quality control rules, and how things were sent out. This knowledge was helpful in rebuilding Germany's drug industry after the war. The amount of medicine ready in American camps, from simple aspirin to new antibiotics, showed a manufacturing strength that was far beyond anything the German drug industry had managed. This view of America's huge supply of medications changed how German medical staff saw what modern medicine could do with enough supplies. The sharing of surgical skills between American and German medical staff was one of the most helpful sides of their professional connection. German surgeons, many with vast war zone experience, shared injury treatment methods they had learned through years of healing injuries during war. American surgeons shared new discoveries in pain management, clean procedures, and after-surgery care. This two-way sharing of knowledge, although held back by language difficulties and security rules, still helped both medical groups. German medical techs and lab workers among the prisoners worked in camp labs doing regular diagnostic tests and helping with camp medical activities. These workers learned about American lab methods tools, and quality control rules that were often stronger than German military lab abilities. The structured approach to lab work in American centers, with set ways of doing things, regular equipment checks, and full records, provided a model for how to develop post-war German lab medicine. German radiologists and X-ray technicians among the prisoners used equipment in camp medical centers. American radiology equipment, especially how dependable it was and the quality of its images, greatly affected the German staff who were used to working with old equipment and few replacement parts. Security guidelines in American radiology, including radiation safety for both patients and staff, were higher than German military medical standards. This experience with radiation safety had an effect on post-war German radiology methods. The International Red Cross was a main link in the experience of the German medical personnel. Red Cross visits proved that medical staff were treated by the rules of the Geneva Convention, including professional respect and appropriate work. Red Cross packages supplemented the medical supplies in some camps, although the American military supply was usually plenty. More importantly, the Red Cross helped German medical staff talk with international medical groups, holding them partly tied to new findings in medicine. Many prisoner of war camps printed newspapers written by and for the prisoners. These papers, which were reviewed by American guards but generally had a lot of freedom, contained medical and health articles written by German medical staff. These articles discussed how to stay healthy, sickness prevention, and medical news, giving German medical staff a way to hold on to their job identity and share information with other prisoners. The newspapers kept in different archives offer a look into how the German medical staff felt about their situation. Although it was not much, some German medical staff were given permission to do medical research while in American hands. This research was on open topics like nutritional problems among prisoners or patterns of sickness in the camps, which allowed German medical scientists to maintain their research skills. The chance to do even a little research, with access to labs and statistical help, was better than what many German medical researchers had in war-damaged Germany's collapsing research system. Sickness spreading quickly in the camps needed combined medical efforts that brought American and German medical teams together for urgent teamwork. These responses to epidemics, whether it was the flu, stomach infections, or other catching diseases, showed American methods for stopping outbreaks and public health actions. German medical staff participated in these efforts, getting hands-on experience in studying epidemics, stopping the spread, and mass treatment plans that would be very useful in post-war Germany's difficult public health world. German medical officers saw American systems for keeping track of medical supplies that made sure materials were always easy to get. The organized way of handling inventory, emergency supplies, and shipping network became an example for smart medical delivery. This view of American medical supply organization influenced the German medical officers' view of how modern medical systems could maintain regular supplies even in tough situations. A lesson especially useful for rebuilding Germany's damaged medical services. The way combat injuries were handled in camp hospitals showed German medical staff American progress in wound care. The free use of antibiotics to stop infection, better surgical cleaning methods, and an orderly way of recording wound details were all improvements over German military medical ways. The German medical staff's experience with American wound care procedures influenced post-war German trauma medicine, helping to lead to better results for regular people hurt in accidents. America's focus on preventive medicine in the camps introduced German medical staff to a different medical way of thinking. Having regular health checkups, vaccination programs, and health education efforts showed the power of prevention-focused medicine. This preventive way, while not completely new to German medicine, was given less attention in the German military, which was focused on battlefield injuries. Being part of thorough preventive medicine programs influenced the post-war work of German medical staff. American recovery medicine for wounded soldiers made a strong impression on the German medical staff. The focus on helping wounded soldiers get back to their best possible function, rather than just paying them a pension as sick people, was a different way of looking at being unable to do certain things. German medical staff saw physical therapy, work-based therapy, and job retraining programs that were far beyond anything available in German military medicine. This experience guided the growth of post-war German recovery medicine, American ways of medical sharing of information between professionals, with patients, and in records were different from German methods. The focus on easy-to-read records, patient education, and communication between different specialties provided examples of good medical talking. The German medical staff's experience with these communication styles affected their post-war work, contributing to more patient-centered and team-based medical care in the rebuilt German medical system. The experience of German prisoner of war medical staff in American camps proves that a professional identity can be stronger than national hostility. The American Medical Corps' treatment of captured German doctors as respected co-workers, with whom they openly taught and learned various medical procedures, built relationships that went on even after the war. While the full details of knowledge sharing and professional ties isn't fully clear, the available facts confirm that German medical staff received professional respect that was more than their expectations, and in many cases better than their past experience in the German military. This professional treatment had its limits and problems: security rules, language difficulties, and the simple fact of being a prisoner and a guard kept back full professional connection. Some American medical staff kept a professional distance, and some German medical staff did not like American methods. Still, the written experience of German staff in America remains as a special part of military medical history. The choice to treat enemy medical staff as professional co-workers showed both America's dedication to international law and its core medical values. The influence went further than just individual German medical officers to change post-war German medicine. While it's hard to prove a straight connection, German medical officers who saw American medicine as prisoners aided in the post-war rebuilding of German medicine, bringing with them knowledge of American methods, ethics, and organization. The story of German prisoner of war medical staff in America ultimately proves medicine's power to hold on to professional ties even during a war. By treating enemy medical staff with professional respect, American military medicine not only obeyed international law, but also showed values that were bigger than the fight. This past example is still important for today's military medicine and international medical relationships. The idea that medical professionals have duties they share that go past national lines, as shown in the American treatment of German prisoner of war medical staff, still guides military medical rules and international medical teamwork. The German medical officers who found American friendship instead of the expected anger went back to Germany with more than just medical knowledge. They brought back the experience that professional respect could survive even war, that medical morals were stronger than political beliefs, and that former enemies could become co-workers in medicine's shared mission of healing.